lipo.
Now, let me see. Maybe it's probably going to be the last question if we have time. Do you work on patients who have heart issues?
Um, yes, depending on what the issue is. Sometimes there's people that have something was fixed when they were a child, or something minor, and if they have a proper cardiac clearances and they are considered what they call an ASA2, which is the anesthesia classification. If it's 2 or 1, you'd be a 2 if you have the heart history, then it would be okay. If someone has a serious problem, let's say an artificial valve or some other kind of thing, they won't do that in the office setting. Then that person, if it's a problem that's stable, but just a little bit too much for the office setting, I might do it, but it would have to be in an ambulatory surgery center or an outpatient hospital
Yeah.
experience. So then that's a case by case basis. But if somebody has like a real heart issue, that's got to, then they may not be a candidate. It depends on what the problem is and what your doctor says about it. So we do all that legwork kind of leading up to it. So it's possible. Qualified, yes.
And does every patient need to have a medical clearance before coming to you, or only when they have a condition?
Well, yeah, if you have some medical issues, they do require a medical clearance. That's basically for peace of mind of ourselves, anesthesia, and so forth. And it's good practice. If you're young and healthy, there may not be a reason to do it other than the routine labs. We kind of can look it over and everything's okay. But, sometimes when people have, they've got high blood pressure, they've got, diabetes and things like
Yeah.
that. It's always good to have your doctor say, hey, look, things are looking okay, not a problem. It was funny, I got a clearance, and I think I saw last week or the other, and said, person's cleared, and said, but we were cautioning you that you're going to Miami, and they're making news that we don't like about COVID. So that was kind of funny to
Yeah.
see that clearance.